Hi, welcome to the Dana and Dr. Pearl Show. I'm your host, Dana Arnone, and today we're coming to talk to you about essential workers. Every day we hear the governor talk about essential workers, about the hospital and the doctors, and yes, they're doing a great job, and yes, they're on the front line. But there's a segment of workers that we're not talking about, and that's the home health care worker. I own a home care company, and I can tell you that each and every day we are in the homes of these patients that are in need of great care. When we talk about essential frontline workers, I don't know that you're going to get more of a frontline worker than someone's in the person's home. We are telling our aides every day that they are the difference between someone staying home and someone going to a hospital. We are telling them that they are to assess the patient, look at the patient, tell me if there's something going on so that we can hopefully prevent that hospitalization. So today I'm here talking to one of the essential workers and frontline workers, which happens to be my daughter, Jillian Arnone. I'm very interested in talking to her today because she's out there and she's in the patient's homes. You know, when I talk about people going into the profession of home health care and how wonderful of a job and something that I take great pride in, not just as an owner, but as somebody that also was an aide. Most of my life was spent while I was going to college as an aide, and the importance of being a home care worker and a home health aide is something that I'm really trying to teach my daughter. So Jillian is a student of Adelphi University going for nursing. And right now I sent her to school to be a personal care attendant because I wanted her to get the experience of being a caretaker, learning the basics of caring for somebody, which is in the home. But she was not really prepared for what's going on right now as being one of the essential workers. So I wanted her to come on to talk about her experiences as being a caretaker in the home. She's out there talking and dealing with the patients in the homes every single day. We are not afraid of caring for them. She's not afraid of caring for them. So I just want to have her come on. So Jillian, thank you.
No problem.
Remember, I'm your mother, and be kind. But Jillian, so when I told you that I wanted you to go to school to be an aide, what did you think?
Well, starting off, I grew up around it. So you would always take me to your patients on Sundays. We'd go. I remember Cosmo, that patient, and
Don't say his last name. It's a HIPAA violation.
well, I don't even know it, but
That's okay.
Remember him. So I grew up around it, and I was never really interested in nursing at first, but then seeing you and seeing the connections you made and, all the families and patients, how they like adore you, I was like, maybe I should give it a try. So I did, and I ended up loving it, and becoming an aide myself has just taught me endless amount of knowledge.
So when you talk about nursing students and the people going into nursing, what better experience can they have but dealing in a pandemic crisis situation and going out there and dealing with the patients in the home? So, you talk about doctors and you talk about nurses. And, for me, the feeling of being in a hospital setting and being a nurse in a hospital, which I was for many years, I'm a nurse 30 years. But you have that other person sitting next to you that you can talk to and you can compare, situations with, or if you want help with something, you have that person with you. As a home care worker, they're by themselves. We're talking about someone who is alone with someone at their most vulnerable, where they need the help, and you're alone to care for them. So what I really want to get my message across is that the home care worker is an essential worker. It's somebody that we should be recognizing them as part of the team of keeping people home and stopping the crisis from entering into the hospital setting. So what we do in our office is that we call our aides every day. We talk to them about, how they're feeling, if they've come into contact with anybody with the COVID-19. We give them instruction of if you're feeling sick, stay home. So with Jillian, for her to go to school to be a home health aide, which makes me very proud because I was a home health aide too, but we're trying to really educate the home health aide worker on how to look for the signs of someone that might be getting sick or somebody that is, maybe needing some additional assistance in the house. So Jillian, so you're a nursing student at Adelphi. Mm-hmm. So we talk about, how that's going to help you as a nursing student. Don't laugh. How it's going to help you be a nursing student and how that made you comfortable in the nursing program. Mm-hmm. So when I first told you I wanted you to be a home health aide, your first reaction was what?
I'd rather just keep working in the office.
Yes. And then what did I tell you?
You need the experience.
You do.
your resume, especially.
Yeah, well, as nursing students, going to be a registered nurse is one thing, and going into hospitals and going out there and becoming a nurse, and everybody thinks it's so professional, and everybody thinks that it's such a glamorous job
and an easy job that you're going to get.
That's true, but it's not. So for me, I wanted her to have the baseline knowledge that you have to be caring for people. It's a job about people, and it's a job about caring for them. So when I told her that I wanted her to be an aide, I wanted to be able to not only walk the walk, but talk the talk, right? That's what they say. Mm-hmm. So for her to go out there and to start to actually, go deal with patients in the home, deal with them one-on-one, listen to them, listen to their fears, listen to their concerns, listen to what they're talking about. That is something that she's always going to take with her. And that's something that she can actually pass on to other nursing students that she's talking to, and really be a mentor for them. So we actually look towards, other nursing students to become home health aides, personal care aides. We help sponsor them to go to school, because I feel my mission, whether it is my mission or not, I think it is that we want to change the perception of home care. We want to change who goes into home care. We want to change the ideal of home care. We want people to recognize this as a job that is worthy, that is a job that can be your profession. It's a job that you can really be proud of, and that you're really making a difference in the people's lives. Right now, more than ever, you're looking at a crisis situation. We're talking to people in hospitals and doctors and nurses and nursing homes, which I do most of my business, and most of my, my partners in what I do are all in nursing homes, and they're dealing with an unbelievable amount of stress. But no one's talking about the stress that we in home care deal with. Every day when Jillian goes to work, or one of her coworkers go to work, they are in there. They have to really gown up and protect themselves so they can protect their patients, because we are the defining line between whether or not someone stays home or someone goes to the hospital. So for me, Jillian, when you can talk about me because I'm a very good mentor for you, mm-hmm. But when you go into someone's home, what do I tell you every day?
As soon as you walk in, in my instance with my patient, I take off my shoes. That's, one thing that a lot of people aren't really thinking mm-hmm. about is how, the virus especially can travel on your shoes. Mm-hmm. So I'll walk in, take off my shoes. I'll bring a pair of slippers or something on the side, and I'll put those on, wash my hands. But my mask, my gloves, always on 24/7, no matter what I'm doing, even if I'm 20 feet away from her, doesn't matter,
And how does the patient feel about you putting your mask on?
She feels safe. Mm-hmm. She feels like I'm no harm to her at all. She welcomes me into her home with open arms and doesn't care if I'm there or not. Mm-hmm. She just wants me to do what I do for her and help her. And she doesn't mind with everything going on, even though it is.
She feels safe with you.
Yeah, 100%.
Okay. So she feels safe because she feels that you have the guidance and the knowledge of walking into someone's home, washing your hands, putting your mask on, mm-hmm. Doing the protective things that we've taught all mm-hmm. of our home health aides to do. So what are the things that you feel a home health aide does for their patient? What is your goal? What is the role of a home health aide?
I think it can be different aspects for different people. Mm-hmm. I'm one to make a personal connection. So I definitely...
You get that from me.
Yeah, well, that's what they say. But, I've become very close with my patient that I've seen every Sunday. I talk to her on the phone. Mm-hmm. She'll call me and ask me how my test went, mm-hmm. So it's definitely, I'm more of a personable kind of aide. There's others that are just there to, do what they're there to do the job, take care of them, clean, help them around the house and that kind of stuff. And I do that as well. But mainly I like to have a connection. I like to talk. I like to learn about her past life and mm-hmm. what she's been doing or what she did, how her family was. I know everything about her family. I know her grandchildren. I know everything. Mm-hmm. And for me, that's something I like.
Okay. But you realize that if you weren't there, mm-hmm. how would she do?
I don't think very well. I think she enjoys the company.
Well, the company also helps with the mental status of a patient. Mm-hmm. So right now, if you're an elderly person that's homebound and you are isolated from the outside world, maybe your daily thing was to go to the food store or go to the 99-cent store, and now you can't do that. Just having that connection with the home health aide mm-hmm. will make them feel better. Yeah. They will help them with their depression. They feel a connection with somebody, which is so important. But again, we go back to essential workers. For me, when we talk about essential essential workers and frontline people. I will never take away from the hospitals and the nursing homes because that's who I deal with every day. But I think the other side of things is home care. And something that people really need to address is that home care worker as an integral part of the team of keeping people home and keeping people safe and keeping people out of the hospital. This week alone, we've had a couple of patients go to the hospital testing positive for the COVID virus. And I take that personal because I take that as something that I should have seen, or maybe one of my workers brought it to the home. So we're always trying to look at where we are going at home care and how we can make it better. I don't understand why home care is not something that is discussed. I don't know why home care is something that people don't take as a viable part of the team, because I feel as though at the end of the day, we are the ones that are talking to them, keeping them safe. We're helping them with their medicines. We're helping them hydrate them. We're helping them with their nutrition. We're helping them with their social aspects. We're helping them keep them safe and secure in their home. The families look to home care to make sure that their families are safe. And that's something that I personally take, as part of my duty, as part of my job. It's why I'm here. And one of the purposes that I've had. I've been in home care for the majority of my nursing career. She does not want to go into home care other than being a home health aide.
I mean, you never know.
You never know. Okay, that's true. But she wants to be, the fact that she's going to be a registered nurse, she's going to put her own stamp on things and maybe make her own way. I'd like her to take over because I would like to retire. But I want to teach her. That's not true. But I want to teach her that home care is special. It is what keeps people home. People don't want to be in the hospital, obviously. People don't want to be in the nursing home. People want to age securely and safely in the home. And the person that does that best for them and keeps them in that security of their own home is the home care worker, the home health aide. So I really want to talk to people about the job, the profession. I would not have my daughter do it if I thought it was a low-level job, if I thought it was something that's meant only for people that have no other options. When people come to our office and I'm educating them on home care, I'm telling them that is probably one of the most important jobs that the person will ever have. You are deciding or helping or assessing the person's needs and how they are going to, really age in their own home. Whether it be somebody like Jillian that's there more of a companion, or somebody that really is bedbound that requires, more hands-on care. What we do in Reliance is that we really like to take our home health aides and educate them and then move them up in the ladder of caring for people. Jillian is somebody that we're trying to start to, teach to be a mentor for other nursing students, because when you're going to nursing school, right now you hear nursing, but in a couple of years when you graduate, it may not be all about the nurses. You may be looking for a job. So building that resume of, experience. Jillian came to me. I'm going to say this is probably, it might be cut, but I don't know. When she came home, she saw her first elderly person tiny. It was a little bit of a distressing situation for her, but she got past it. And so when she's in nursing school, now she's going to be like, oh yeah, that's an old person's butt. I've seen that before. Yeah. It's all good. It's not a problem. Yeah. Right? You're not going to be afraid.
I even have the friends that I have that are now home health aides as well that are also in their nursing program with me. A few of them are a year or two ahead of me. So they're doing their clinicals. They're in and out of hospitals. And one of them that I was actually with today, she mentioned to me, she was like, the one thing that I love is that I get to have like a conversation with them versus like the doctors or even the other nurses, they're just in and out. She's like, as the students, we get more like personal time with them. We get to talk to them. And she's like, and this is just something that I get to further that connection like with, and she's like learning how to talk to a patient and, get comfortable with learning about someone's past and like what they've been through.
But it's not, that is, the elderly people that are left in their home or are homebound, whether they have family or not, the connection with that caretaker in the home is something that is undeniable. It is something that they look forward to. I know that they look forward to when Jillian goes to their home. They call my office all the time. They don't know she's well, she knows she's my daughter now, but at the beginning she didn't know. So for me, that connection is what's gonna. Everybody needs to be connected to somebody, right? So everybody needs to feel that they are loved, that they are needed, that they're wanted, and to have the person go into the home and provide that for them, whether it's on a skilled level or a limitedly skilled level, it's still something that they look forward to. So when we talk about essential workers and we talk about people front line, I would love I'm going to say this. I'm going to get in trouble for this too. I would love Governor Cuomo to start to talk about home care, to start to talk about the home care worker as somebody as part of the team, the hospital team, the nursing home team, and the home care team, because the home care team is really ultimately most of the time going to be the difference between someone being home and someone being in the hospital. They talk about the hospital being, flooded with people with coronavirus. And I would assume, I don't know, so I'm not going to talk about statistics, but I would assume most of them are probably 90 and above, right? So how can we keep these people home? We keep the people home by having the essential worker protected, mask, gown, foot booties. Foot booties, whatever. Booties. Take your shoes off, put your slippers
Running
on,
the
wash your
errands
hands.
for them.
Right, yes,
So they
keeping
don't
them
have to
food
go out.
so they don't have to. That's a very good point, Jillian. Okay. So when you talk about doing their food shopping, keeping them with their good nutrition, keeping them hydrated, saying, hey, Mrs. Smith, did you take your medicine today? You didn't take your medicine? Please take your medicine. That's what's going to keep you healthy. Just being there as that person. So when you talk frontline, when you talk about essential, I would love the world to start to think about home care as essential workers. Yes, Jillian, and people like Jillian. So all the nursing students out there, if you want to become a home care worker or an essential worker and start your career path in home care and then move on to nursing, I think this is the best track that you can do. Jillian is doing it. I myself did it. It paid for my nursing school. When I was an aide, it was a little different back then, but I was very, very proud of the job that I did. Still, I look back on those days as fondly. I can tell you stories of patients still to this day that I took care of 30 years ago that it impacted me on my home care side, as well as my being a nurse and nurse's aide in the hospital and in the home. No, not the home care. Nursing home, sorry. Anyway, so when we talk essential, so tell me out. So you get up, you go to see a patient, you take your shoes off, you wash your hands, you put your mask on, you start their breakfast, you make sure that they're eating properly, you make sure that they're taking their medicines, you go pick up their medicines if they need it, you go to the food store to them.
Recently, it's been delivery, which is kind of nice. CVS will drop it off.
But you're reminding her, saying,
yes,
hey, where's your medicine, blah, blah, blah,
yeah.
right? So
I'm lucky. My patient is very aware, so she's
very aware.
Yes, so she knows that she's like, oh, like I have to take my medicine, and I'm like, yes, you do. Like I could have reminded you, but she knows what's going on.
But what's the most important part of your patient for her?
For her, I think it's definitely the aspect of me going out and food shopping for her and helping her. I'm only there once or twice a week, working like the weekend shifts usually with her, but she definitely needs help with food shopping. That's like one main thing that she, especially at this time right now, she usually would do. One of her family members would usually take her and drive her. She'd take one of the transportations and stuff and go out, but right now she's petrified to leave her house. So she always asks me to go, and I'm more than happy to.
So let me ask you a question, because this is something that we're dealing with in home care right now. There's a lot of home health care workers that are afraid to go to people's homes. They're afraid of the virus. They're afraid to, to even go out into someone's house. So what makes you not afraid, other than the fact that your mom gave you superpowers? But other than that,
being realistic. If anything, I would be the one risking her to getting the virus. It wouldn't really be the other way around. No, she's not going anywhere. She's staying home because she wants to stay safe. And and everyone else in the world and other aides that are afraid to work, you have more risk going out food shopping for your family than you do just going to take care of your elderly patient. So for me, I'm taking precautions when I go out on my own behalf and on my own time. If I'm going to the store or something, like I'm taking care of myself, not only for myself, but also because I know I have to go to my patient. So it's definitely not.
You would feel really bad if she got sick.
Of course I would. Very bad.
So you take extra precautions even on your normal day.
I'm wearing masks, gloves, hand sanitizer in my car,
But you feel safe going out and you feel safe caring for her.
Yes.
Okay. See, that's something that other people need to realize, is that you can take precautions and be safe and you can take care of your patients.
Yeah.
Because that's what we do. We take care of people. This is not a job that my biggest pet peeve in this whole thing is that either you flip a burger or you take care of a patient. That's not the way it should be. It's that you're Well, it's true.
No,
Well,
yeah.
you're laughing
I'd rather, because I'd rather do what I'm doing.
I know, but because you have a heart about it. You have to have the heart, you have to have the need, you have to have that side of you. So I always say to people when they come to our office to apply or go through orientation, this is not an easy job. Sometimes you get yelled at. You're not going to have the nicest patient at the time. But if
I've been blessed so far.
Yeah, that's true. But you also have to know that you're there for a reason. You're there for a task. You're there to, to take care of them. But you're also there to assess. And you're there to identify problems that could be happening. You're there to say, hey, you know what? My patient doesn't seem the same today.
But that sometimes can be an issue when the aides aren't taught. They are taught to be aware and keep an eye out for certain things, but it's different when you're a nursing student because you want to do that. You want to look out for that stuff because that, you're learning about all this stuff in school and then you're like, wait a minute, like I'm seeing that, or, this could be
something. So what
something.
I'm hearing right now, that this is the perfect job for a nursing student.
It really is.
It really is.
And when I tell you, I have my friends, I get text messages every single day from kids, boys, men, girls, everyone. They all want to become a home health aide. And it's not about the money. None of them care about the money. They just want to do a shift here and there and get some experience. And, a lot of them are in the clinical settings right now. So they are in and out of the hospitals, or they're like me, where in the fall I will be doing that, but I'm going to walk in knowing what I'm doing already. I'm going to walk in there saying like, oh, bed bath, I got this. I could do that. I don't need to be taught, but obviously I will be taught, but I won't need it. I'll have the experience. And
you can thank your mother for all of that.
Yeah. I guess so.
Just like I can thank my mom. That's how I got into being an aide. Grandma was an aide for a very long time in a nursing home, and she used to tell me all the time.
I didn't know that.
Yeah, Grandma was an aide.
Huh.
Yeah. So she got me, I was a patient feeder. And then from a patient feeder, I went on to be a nurse's aide. And then I was going to nursing school. So it's a very good stepping stone for people. But more importantly, the aspect of the job is that it can be a profession. It's not a job that people should look down upon. It's not something that somebody should say, oh, you're an aide?
Yeah. No.
No, you should say, instead, I'm a caretaker.
I'm getting all that. I think it's definitely heading in the direction that we want it to, especially with the responses that I get from like my friends that are reaching out, even people I don't know that are just hearing it through the grapevine.
That could be just because I'm your mother and they just want to be part of my team.
No, I think it's because of me.
No, I don't think so.
Okay.
Well, you can think what you want. It starts here.
All right. Well, back to my story. Everyone has such a positive outlook on it. They're excited. Even the one aide that I supervised today, she was like, very ready to go, like smiling and excited.
See, that makes me happy. Who would ever think that
a 20-year-old would be excited to take care of an 90-year-old?
Yes, I think it's wonderful. It's what I've dreamed of. It's the purpose in what we're doing. But more importantly, back to Governor Cuomo, because it's all got to go back to Cuomo and Trump. We are essential workers. We are the people that, when you talk about frontline, we are frontline people. We are the people in the home.
We're like the front line.
Front. We're the before the front line.
Yeah.
Is there a before the front line? I think
that we're
that. We're the pre-front. I like that. We're the front line. And for people to think about home care in the respect that it deserves and the ideal and the profession is really what this is about. It's about keeping people home safe, secure, identifying our home care workers as people that are essential, giving them the tools that they need to make themselves safe, but more importantly, to make their patients safe as well. Because if the worker is safe and secure and confident in their skill set, their patient will be safe as well. So we at Reliance, that's why I love using nursing students, because it's how I learned. It's how I want my daughter to learn. You learn at the bottom and you work your way up. That's what we try to do. And it's a profession that you can be proud of. It's a profession that you can feel, that you can go out and tell people about how when you go into the food store, when you do food shopping for them.
Oh, I get stopped constantly. But the first thing they say is, are you a nurse?
Are you Dana's daughter?
No, they don't say that. They say, oh, are you a nurse?
Yes.
And I'm always like, not yet. I will be eventually. But as of like right now, I'm a home health aide. And they're like, God bless. Like, thank you for what you're doing. And, I'm getting the recognition from
But it's positive recognition.
Yeah, positive recognition.
It is not negative.
But I'm getting it in the supermarket. But I'm one person. And you don't see a bunch of aides walking around the supermarket doing what I'm doing. It's, different. But
But they're there.
But it should be nationalized. It should be posted up there.
It should be something that people feel happy to say that they are. It should not be something that they're ashamed of. It should not be something that is a minimum wage worker's job, because that's really, they do above and beyond. I tell you all the time, when I was a nurse's aide in a nursing home, I would sit there and I would say to somebody, hey, can I have a lift? Hey, can you help me with this Hoyer lift? Hey, can you help me with this person? Oh, this person's in the bathroom. Can you help me lift them up? Or what do you think about this? You always had someone to talk to. But in the home, it's one-on-one. It is one caretaker with a patient, and that patient is relying on that caretaker for all aspects of their care, from their dietary, from their hydration, to their physical care, emotional care, mental care, making doctor's appointments, just making sure that they're secure. But yet they're looked down upon. When you're alone in that house, that is something that you have to have the skill set to say, I can see there's a problem. I know that there's a problem. Let me call my nurse. Let me call the family. Let them identify the fact that this person's having an issue right now. So I just want to end this by saying, you're welcome.
Well, no, you're welcome.
I'm joking, but I'm very proud of you. I'm very proud of the fact that you see it as a profession that you can be proud of. You don't say, "Oh, I'm a home health aide." You say, "I'm a home health aide." Somebody, you do.
And I say, you should be one too.
You should be one too. And she's out there recruiting all nursing students. But for me, it's about the nursing student. It's about the allied professional. It's about the stay-at-home mom that maybe says, I want to help my husband pay, the light bill this month. It's about the people that say, you know what, maybe healthcare is something, you see the crisis going on right now. It's something that you want to be a part of. It's something that you think that maybe you can impact another individual's life, and you might want to be a home caretaker, a home worker. I think that you should give us a call. You can call Jillian, you can call me, but we are here to say that it's a profession you can be proud of. We are essential workers. I think we are the frontline people.
Pre-front.
Oh, pre-front. We're the pre-front people. But in all seriousness, though, we are the people that are the barrier between staying home and going to the hospital. So I hope that this has been something that it'll impact you, it'll educate you, it will empower you, it will make you feel strong, and it'll make you feel like this is something that is a profession that you might be interested in, because it's something that I hold very dear to my heart. I have my daughter doing it, a lot of her friends doing it. And for them, it's going to be the difference between, how they become a registered nurse in their future. It will humble them. It will make them be better caretakers. It will make them see things a little bit differently. But more importantly, it's going to give you that humility and that caring and that side that I think is really what's needed right now. So I thank you.
Thank you.
You're welcome. So from Dana and Jillian Arnone, this is the Dana and Dr. Pearl Show. I thank you so much for tuning in, and I hope that you enjoyed this show. We'll talk to you next week. Thanks, Long Island.
Bye.
Bye.